Serotonin, melatonin, and niacin are synthesized from what precursor? A. L-tryptophan. B. N-acetylcholine. C. The answer is A. L-tryptophan. Serotonin, melatonin, and niacin are all synthesized from L-tryptophan, an amino acid prevalent in many foods including chocolate, oats, dates, milk, sesame seeds, eggs, meat, and cheese. L-tyrosine is involved in the synthesis of dopamine. Acetylcholine is the neurotransmitter released at the neuromuscular junction, which stimulates contraction of skeletal muscle. Taurine has many biological functions in the cardiovascular, muscular, and nervous systems, as well as others.
Which of the following symptoms would be most likely to present in a patient with a biotin deficiency? A. Thyroiditis. B. Alopecia. C. Nausea. D. Edema. The answer is B. Alopecia. Biotin, or vitamin B7, plays an important role in the health of the hair, nails, and skin. Deficiency generally manifests as alopecia, loss of hair color, brittle nails, and dermatitis. Nutritional intervention may include all of the following except dash. A. Admonishing patients for dietary indiscretion. B. Diet prescription or recommendation. C. Providing specific nutrient supplementation. D. Initiating tube feeding. The answer is A. Admonishing patients for dietary indiscretion. Offering a treatment plan that includes specific nutrient supplementation and a dietary protocol is a normal part of a nutritional counseling and intervention. Initiating tube feeding is only necessary in cases of anorexia or other forms of malnourishment, but is still within normal procedures. Admonishing patients for their dietary choices, however, would be counterproductive to the nurse's attempt to foster trust and willingness on the part of the patient, and so would be inappropriate in an intervention setting. Which of the following conditions is caused by chronic protein deficiency? A. Pellagra. B. Kwashiorkor. C. Marasmus. D. Beriberi. The answer is B. Kwashiorkor. Kwashiorkor is a condition of sufficient caloric intake with severe protein malnutrition, often seen in impoverished areas where individuals must survive on carbohydrate-based sources of nutrition. This results in a severe deficiency of albumin, with symptoms such as edema, ascites, fatty liver, and dermal ulceration. Marasmus is a condition not specifically of protein deficiency but of general starvation, which may be due to lack of food security or to intentional fasting or extreme caloric restriction. Pellagra is a condition caused by niacin deficiency, and beriberi is a thiamine deficiency syndrome with neurological, gastrointestinal, and cardiac manifestations. Which of the following nutrients can cause hypercalcification in soft tissues when consumed in excess for prolonged periods? A. Magnesium. B. Potassium. C. Niacin. D. Vitamin D. The answer is D. Vitamin D. Hypervitaminosis D, or vitamin D toxicity, has been known to cause calcification in soft tissues due to vitamin D's role in calcium absorption and metabolism. None of the other nutrients are as closely related to calcium metabolism, and do not cause hypercalcification in soft tissues when overconsumed. Methylene tetrahydroflate reductase, MTHFR, deficiency results in the inability to perform which of the following metabolic processes? A. Methylation of folate. B. Homocysteine remethylation. C. Methylation of vitamin B12. D. All of these. The answer is D. All of these. Methylene tetrahydroflate reductase, MTHFR, is an enzyme with multiple important metabolic roles, including the methylation of folate, vitamin B12, and homocysteine. MTHFR deletions can result in folate and B12-related anemias and high homocysteine due to interruption of homocysteine recycling into methionine. Which of the following is an essential amino acid? A. Glutamate. B. Cysteine. C. Alanine. D. Tryptophan. The answer is D. Tryptophan. Essential amino acids are amino acids that cannot be synthesized within the body, but must be consumed through the diet. Tryptophan is the only essential amino acid listed. In all, there are 9 essential amino acids. All of the following criteria must be taken into account when establishing daily reference intakes, DRIs, except dash. A. ULs, upper intake levels. B. EAR, estimated average requirements. C. ADI, active daily intake. D. RDA, recommended daily allowance. The answer is C. ADI, active daily intake. All of the criteria listed and AI, adequate intake, not listed, must be taken into account when establishing a daily reference intake, DRI, except for ADI, active daily intake, which is a fictitious criteria. Which of the following is the most abundant mineral in the human body? A. Calcium. B. Magnesium. C. Iron. D. Potassium. The answer is A. Calcium. The most abundant mineral in the human body is calcium. It is primarily stored in the bones and the teeth, and makes up half of the total weight of the skeleton. In addition, calcium is present in nerves, muscle cells, blood, kidneys, and various other soft tissues of the body. What is the formula for calculating body mass index, BMI? A. Weight, in pounds, divided by square of height, in inch. B. Square of height, in inch, divided by weight, in pounds. C. Square of height, in meter, divided by weight, in kg. D. Weight, in kg, divided by square of height, in meter. The answer is D. Weight, in kg, divided by square of height, in meter. In standard units, the formula for body mass index is weight, in pounds, divided by square of height, in inch, the whole multiplied by 703. Which of the following is considered a normal body mass index, BMI? A. 18.5 to 24.9. B. 22.9 to 30.5. C. 16.9 to 22.9. D. 26.5 to 32.9. The answer is A. 18.5 to 24.9. Normal BMI is considered to be 18.5 to 24.9. A BMI below that would indicate that the individual is underweight, while a higher value may indicate that the individual is overweight. The answer is A. 40. BMI values between 30 and 39.9 indicate obesity, while a BMI over 40 could indicate that the individual is severely obese. A BMI over what value could indicate severe obesity? A. 40. B. 38. C. 36. D. 34. Which of the following is a water-soluble vitamin? A. Vitamin B5. B. Vitamin D. C. Vitamin E. D. Vitamin A. The answer is A. Vitamin B5. Vitamin B5, or pantothenic acid, is the only water-soluble vitamin listed. Vitamins A, E, D, and K are all fat-soluble and so should be consumed with fat to be absorbed. Which of the following nutrients delays gastric emptying, increases satiety, and lowers LDL cholesterol by interfering with the absorption of dietary cholesterol? A. Unsaturated fat. B. Soluble fiber. C. Carbohydrates. D. Insoluble fiber. The answer is B. Soluble fiber. Soluble fiber, present in oat bran, barley, nuts, seeds, and legumes, delays gastric emptying, increases satiety, and lowers LDL cholesterol by interfering with the absorption of dietary cholesterol. Insoluble fiber passes through the gastrointestinal tract relatively intact, provides bulk for stool, and reduces bowel transit time. Carbohydrates and unsaturated will not lower LDL cholesterol or delay gastric emptying, though they will increase satiety. Which of the following vitamins will be better absorbed when taken with a meal that contains fat? A. Vitamin D. B. Vitamin B2. C. Vitamin C. D. Vitamin B6. The answer is A. Vitamin D. Vitamin D is a fat-soluble vitamin, and so will be better absorbed when taken with a meal that contains fat. The other vitamins listed may be better absorbed with food, but do not require fat for transport across intestinal membranes, as they are water-soluble. Which of the following is a conditionally essential amino acid? A. Arginine. B. Aspartic acid. C. Methionine. D. Histidine. The answer is A. Arginine. Conditionally essential amino acids are those that can be produced by the body under normal circumstances, but may not be able to be produced during certain situations, such as certain disease states or severe catabolic stress. Arginine is the only conditionally essential amino acid listed. Histidine and methionine are both essential amino acids, while aspartic acid is a non-essential amino acid. Which of the following nutrients has strong antioxidant properties? A. Potassium. B. Biotin. C. Copper. D. Vitamin C. The answer is D. Vitamin C. Vitamin C is one of the body's most important antioxidants. Antioxidants are reducing agents, that is, they themselves get oxidized. Recall, oil rig. Thus antioxidants such as vitamin C are electron donors, able to stabilize the free radicals produced by various metabolic processes in tissues and extracellular spaces. Vitamin E, not listed, is another important antioxidant and is actually more potent than vitamin C. Which of the following substances, produced in the stomach, aids in later absorption of vitamin B12 in the small intestine? A. Hydrochloric acid. B. Intrinsic factor. C. Pepsin. D. Gastric lipase. The answer is B. Intrinsic factor. While all of the substances listed are present in gastric secretions and are necessary for normal digestion, intrinsic factor is the only one that has a direct role in vitamin B12 absorption in the small intestine. Deficiencies in intrinsic factor due to genetic variation or damage to stomach lining can result in pernicious anemia, a type of anemia that is caused by insufficient levels of B12. What enzyme, present in saliva, initiates the digestion of carbohydrates? A. Lipase. B. Protease. C. Pepsin. D. Amylase. The answer is D. Amylase. The digestion of dietary carbohydrates is initiated by amylase, an enzyme present in saliva. This enzyme breaks down long carbohydrate molecules into shorter units such as disaccharides. Lipase breaks down fats and is not present in the saliva, rather it is secreted by the pancreas into the duodenum. Pepsin is a protease, an enzyme that breaks down proteins. This enzyme is secreted by the chief cells of the stomach in its zymogen form, pepsinogen. It is activated by the product of the parietal cells, hydrochloric acid. Note that amylase is also secreted by the pancreas to complete the chemical digestion of carbohydrates into monosaccharides so that they can be absorbed by the brush border of the small intestine. What organ produces the bile necessary for digestion of lipids? A. The stomach. B. The liver. C. The duodenum. D. The gallbladder. The answer is B. The liver. Bile is produced exclusively in the liver. It may then be stored in the gallbladder so that it can be released during digestion of a fatty meal. No bile is produced in the stomach, nor the duodenum. The vast majority of bile is cholesterol derivatives that stick to dietary fiber and are excreted along with the fiber. Thus increasing fiber is, mainly soluble, is an effective way to decrease cholesterol. Which of the following is a necessary cofactor for the production of collagen? A. Thiamine. B. Vitamin D. C. Selenium. D. Manganese. The answer is D. Manganese. Manganese, found in oats, brown rice, chickpeas, and spinach, is a cofactor for the enzymes that produce the amino acid proline. Proline is essential for collagen shape and integrity, and is an amino acid, not a cofactor. Other important minerals required for collagen production include copper, zinc, vitamin C, and iron. Which age group has the highest risk for physiological changes due to malnutrition? A. Over 72. B. 12 to 24. C. Over 60. D. 1 to 18. The answer is D. 1 to 18. Children ages 1 to 18 are at the highest risk for physiological changes due to malnutrition. Significant nutritional deficiencies at this age can cause failure to thrive, stunted growth, long-term brain damage, and increased incidence of cardiovascular and metabolic disease later in life. Which of the following minerals must be supplemented in a patient who is on a long-term laxative prescription? A. Calcium and potassium. B. Manganese and selenium. C. Magnesium and chromium. D. Zinc and copper. The answer is A. Calcium and potassium. Prolonged laxative use can lead to hypokalemia and hypocalcemia. This is due to alterations in gastrointestinal absorption and excretion of potassium and calcium. Magnesium can also be depleted during long-term laxative use, but chromium is unlikely to be affected. Zinc, copper, manganese, and selenium are also not generally impacted by normal laxative use. Which of the following foods is highest in vitamin K? A. Sweet potatoes. B. Dark leafy greens. C. Pumpkin. D. Beets. The answer is B. Dark leafy greens. Dark leafy greens such as kale, collard greens, and chard have among the highest levels of vitamin K of any food. The other foods listed, beets, sweet potatoes, and pumpkin all have very low vitamin K content, and are safe for a patient on a warfarin diet. Which of the following foods would be unsafe to consume for a patient taking atorvastatin? A. Orange juice. B. Fish. C. Grapefruit. D. Dark leafy greens. The answer is C. Grapefruit. Grapefruit can decrease the activity of cytochrome P450, one of the body's most important detoxification pathways, by as much as 30%. Consumption of grapefruit while on certain medications, including atorvastatin, can lead to toxic levels of the drug. All other foods listed are safe for patients to consume while taking atorvastatin. Which of the following foods should be avoided in patients who are taking a potassium-sparing diuretic, such as amiloride? A. Tree nuts. B. Alcohol. C. Orange juice. D. Red meat. The answer is C. Orange juice. Patients who are taking potassium-sparing diuretics must be counseled to eat a diet low in potassium. This is due to the fact that consumption of potassium-rich foods, such as orange juice, can lead to dangerously high potassium levels. Excess potassium levels can cause heart arrhythmia and sudden cardiac death. A low potassium diet would be recommended for a patient with which of the following conditions? A. Kidney failure. B. Liver failure. C. Gallstones. D. Diabetic neuropathy. The answer is A. Kidney failure. The kidney is the main route of potassium excretion in the body. During kidney failure, the kidneys are unable to remove excess potassium from the blood. This can lead to hyperkalemia, which can cause nausea, weakness, numbness, arrhythmia, and cardiac arrest.
Allicin, a compound with antibacterial, anti-inflammatory, and antithrombotic properties, is found in which of the following foods? A. Garlic. B. Cold water fish. C. Broccoli. D. Cocoa. The answer is A. Garlic. Allicin is found primarily in garlic, and has a variety of properties that are beneficial to the health. It is antimicrobial, anti-inflammatory, antithrombotic, it can reduce atherosclerosis, decrease blood pressure, and act as a mild antioxidant.
Which of the following is the best source of omega-3 fatty acids? A. Grapeseed oil. B. Wheat germ oil. C. Ground flax seeds. D. Shrimp. The answer is C. Ground flax seeds. Half an ounce of ground flax seeds provides over 130% of the dietary reference intake, DRI, of omega-3 fatty acids. An equivalent serving of shrimp is able to provide 15% of the DRI. Wheat germ oil and grapeseed oil are both good sources of omega-6 fatty acids but are not significant sources of omega-3 fatty acids. Which of the following is thought to reduce pain by depletion of substance P when applied topically? A. Purandin. B. Polypeptide P. C. Capsaicin. D. Curcumin. The answer is C. Capsaicin. Capsaicin, found in cayenne peppers and other species of plants in the genus Capsicum, is used in topical analgesic creams to reduce joint and muscular pain. It is thought to work by depletion of substance P in the sensory nerves. What three parts does the brainstem consist of? A. Pons, cerebellum, medulla. B. Corpus callosum, medulla, and cerebellum. C. Medulla, pons, and midbrain. D. Midbrain, cerebellum, pons. The answer is C. Medulla, pons, and midbrain. The brainstem consists of the medulla, the pons, and the midbrain. The cerebellum is an outgrowth posterior to the pons. The corpus callosum is the broad bundle of neural fibers that attaches the left hemisphere of the brain to the right hemisphere. Olfaction is what form of sensory reception? A. Chemoreception. B. Thermoreception. C. Mechanoreception. D. Baroreception. The answer is A. Chemoreception. Olfaction is form of chemoreception, or a translation of a chemical signal into an action potential. Smells are triggered by molecules of volatile chemicals that trigger chemoreceptors in the epithelium of the olfactory cleft. Olfactory nerves travel through what structure in order to enter the skull? A. The cristagalli. B. The cribriform plate. C. The ethmoidal labyrinth. D. The perpendicular plate of the ethmoid. The answer is B. The cribriform plate. The olfactory nerves travel through the cribriform plate of the ethmoid bone. The grooves of the cribriform plate support the olfactory bulb, and the bone is perforated by many tiny foramen for transmission of the olfactory nerves from the epithelium of the nasal cavity to the olfactory bulb. The other structures listed are all bony features of the ethmoid bone, but they do not allow the passage of olfactory nerves. Approximately how many action potentials must be triggered in an olfactory receptor neuron in order for a smell to be detected? A. 40 to 50. B. 1. C. 200 to 250. D. 80 to 100. E. 2 to 5. The answer is A. 40 to 50. Olfactory receptor neurons require 7 to 8 molecules of a volatile odorant to trigger an action potential, and approximately 40 action potentials must be triggered in an olfactory receptor neuron in order for a smell to be detected. What type of cell is embedded in the olfactory epithelium? A. Olfactory sensory neurons. B. Supporting cells. C. Basal cells. D. All of these. The answer is D. All of these. There are 3 types of cells embedded in the olfactory epithelium: basal cells, supporting cells, and olfactory sensory neurons. All 3 of these cells play a significant role in the sense of smell, though the olfactory sensory neurons are the only cell type that actually respond to chemical stimuli. All of the following parts of the brain are involved in olfactory sense and recognition except which of the following? A. The insula. B. The arcuate nucleus. C. The piriform complex. D. The orbitofrontal cortex. The answer is D. The arcuate nucleus. The olfactory perception is managed by several parts of the brain, the primary areas being the piriform cortex, the insula, and the orbitofrontal cortex. Other lesser involved areas of the brain include the anterior olfactory nucleus, the amygdala, the entorhinal cortex, and the olfactory tubercle. The arcuate nucleus is an area of the hypothalamus that is involved in regulation of hunger and satiety. Where is the olfactory epithelium is located? A. The eustachian tube. B. The inferior turbinate. C. The sphenoid sinus. D. The roof of the nasal cavity. The answer is D. The roof of the nasal cavity. The olfactory epithelium is located at the roof of the nasal cavity in a relatively large area that includes the superior turbinate and the superior portion of the nasal septum. There are no specialized olfactory cells on the inferior turbinates, and no olfactory receptors in either the sphenoid sinus of the eustachian tube. Which of the following tastes has the lowest detection threshold? A. Sour. B. Sweet. C. Salty. D. Bitter. The answer is D. Bitter. The human tongue can detect bitter flavors at concentrations as low as 8 micromolars per liter. In comparison, in the average person the detection threshold for sucrose is 10 millimoles per liter. The reason for the extreme sensitivity of the human tongue to bitter flavors may be protective, as many poisonous or toxic substances have a bitter taste. All taste buds of the tongue are located in what structures? A. In the palatoglossal arch. B. In the apex. C. In the terminal sulcus. D. In the papillae. The answer is D. In the papillae. Taste buds are located in the papillae of the tongue, a group of structures lining the surface of the tongue from the apex to the base. These papillae are also present in the cheek, the soft palate, the epiglottis, and the upper esophagus. They are not present in the palatoglossal arch. Of the 4 types of lingual papillae, which is the only type that does not contain taste buds? A. Filiform papillae. B. Foliate papillae. C. Circumvallate papillae. D. Fungiform papillae. The answer is A. Filiform papillae. Filiform papillae, the most numerous of the lingual papillae, is the only type that does not contain taste buds. Rather, they serve to move food toward the esophagus, cleanse the interior of the mouth, and spread saliva onto food and mucous membranes. Which of the following cranial nerves is not involved in the sensation of taste? A. The vagus nerve, cranial nerve 10. B. The trigeminal nerve, cranial nerve 5. C. The glossopharyngeal nerve, cranial nerve 9. D. The facial nerve, cranial nerve 7. The answer is B. The trigeminal nerve, cranial nerve 5. The sensation of taste is carried to the brainstem by 3 cranial nerves: the facial nerve, CN7, the glossopharyngeal nerve, CN9, and the vagus nerve, CN10. The facial and glossopharyngeal nerves both communicate sensation from the tongue, while the vagus nerve transmits sensory information from the epiglottis. The trigeminal nerve, CN5, is not directly involved in the sensation of taste, though there is evidence that it is involved in the senses of heat and coolness experienced while eating spicy or minty foods. In addition to the tongue, epiglottis, and pharynx, taste receptors are located in which of the following organs? A. The testicle. B. The pancreas. C. The lung. D. All of these are correct. The answer is D. All of these are correct. In addition to the taste receptors in the mouth and pharynx, taste receptors are located in many other areas of the body. These including the lung, which has taste receptors for bitter flavors, possibly as a mechanism to protect against airborne toxins, the pancreas, the small intestine, the stomach, the brain, and the testis. While the function of taste receptors in the testes is not well known, some research indicates that testicular taste receptors may play an important role in male fertility. Which of the following tastes is not associated with a G protein-coupled receptor? A. Bitter. B. Salty. C. Umami. D. Sweet. The answer is B. Salty. Sweet, umami, and bitter taste are all correlated with receptors for guanine nucleotide binding proteins, also known as G proteins. Taste bud receptors that transmit information about saltiness are triggered by sodium ion channels in the cell wall. Which of the following is not a form of lingual papillae? A. Stratified. B. Foliate. C. Circumvallate. D. Fungiform. The answer is A. Stratified. The 4 types of lingual papillae are fungiform, mushroom-shaped, filiform, thread-like, circumvallate, and foliate. Filiform papillae are the most numerous, covering the majority of the anterior 2/3 of the tongue. Fungiform papillae are scattered along the surface of the tongue, but are more concentrated on the tip and sides of the tongue. Foliate papillae are located on the sides and back of the tongue, and circumvallate papillae are the large, round papillae visible in a row on the posterior aspect of the tongue, just anterior to the foramen cecum and sulcus terminalis. Which of the following triggers sour taste receptors in taste buds? A. Sodium ions. B. Glutamate. C. Hydrogen ions. D. Gustdusen. The answer is C. Hydrogen ions. Sour flavor taste bud receptors are triggered in the presence of hydrogen ions, thus acidic foods often have a sour taste. Sodium triggers receptors for salty flavor, while glutamate and gustdusen, a guanine nucleotide binding protein, or G protein, are associated with umami, sweet, and bitter flavors. Which of the following is the most superior vertebra of the spine? A. The atlas. B. The dens. C. The axis. D. The coccyx. The answer is A. The atlas. The most superior vertebra of the spine is the atlas, or C1. This bone sits on the axis, or C2, over a bony process called the dens. The coccyx, or tailbone, is part of the sacrum. How many cervical vertebrae are in the human spine? A. 5. B. 6. C. 7. D. 12. The answer is C. 7. There are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. The mnemonic for this is breakfast at 7, lunch at 12, dinner at 5. What bone forms the most posterior and inferior part of the skull? A. The ethmoid bone. B. The maxilla. C. The occiput. D. The sphenoid bone. The answer is C. The occiput. The occiput is the inferior and posterior bone of the skull. It wraps under the bottom of the skull and forms the base on which the head articulates with the spine. The ethmoid bone and sphenoid bone are housed primarily within the skull, and the maxilla forms the upper jaw and part of the orbit. What is the name for the bony protuberances at which the occipital bone articulates with the atlas? C1. A. The onion. B. The external occipital protuberance. C. The external occipital crest. D. The occipital condyles. The answer is D. The occipital condyles. The bony protuberances at which the occipital bone articulates with the atlas, C1, are the occipital condyles. The external occipital protuberance, external occipital crest, and onion are all part of the occipital bone and serve as the attachment points for various muscles and ligaments. What suture joins the frontal bone to the parietal bones? A. The parietal suture. B. The coronal suture. C. The frontal suture. D. The sagittal suture. The answer is B. The coronal suture. The suture that joins the frontal bone to the parietal bones is the coronal suture. The sagittal suture joins the two parietal bones together along the sagittal plane of the skull. There are no sutures named after the frontal or parietal bones themselves. A patient presents to the ER complaining of pain in his heart. When the nurse asks him to point to the area that he feels the pain, he places his finger on the bony protuberance just below his rib cage. Seeing this, the nurse has reason to suspect that his pain may be gastrointestinal or musculoskeletal in origin as well as cardiac. What bony protuberance is this patient likely touching? A. The manubrium. B. The costal cartilage. C. The body of the sternum. D. The xiphoid process. The answer is D. The xiphoid process. The costal cartilage of the ribcage is joined to the sternum, which is made up of three bony structures. The most superior is the manubrium, which articulates not just with the costal cartilage of the first rib but also with the clavicles. The body of the sternum is inferior to the manubrium, and articulates with the second through fifth ribs. The xiphoid process is a small protuberance just below the body of the sternum, at the point where the bottom of the ribcage meets the sternum. It is an attachment point for several muscles, including the diaphragm, the rectus abdominis, and the transverse abdominis. This is a common location for referred pain from gallbladder disease, GERD, or pain due to musculoskeletal injury or irritation. Which of the following is the name of the bony landmark that forms the ridge of the brow? A. The coronoid process. B. The globula. C. The superciliary arch. D. The orbit. The answer is C. The superciliary arch. The bony ridge of the brow is formed by the superciliary processes. Superciliary means super, or above, cilia, the lens of the eye. The orbit refers to the bony socket in which the eye sits. The globula is the small depression between the eyebrows where the two superciliary arches meet. The coronoid process is part of the mandible, or jawbone, and unrelated to the brow. What structures of the skull form the cheekbones? A. The mental protuberance. B. The pterion. C. The zygomatic arches. D. The styloid processes. The answer is C. The zygomatic arches. The cheekbones are formed by the zygomatic arches, which are part of the temporal bones of the face. The mental protuberance forms the chin, the styloid processes are just under the ears and serve as an attachment point for several muscles of the mouth and throat, and the pterion is the suture where the frontal, parietal, temporal, and sphenoid bones come together. Which of the following is the name for the foramen that forms the ear canal? A. The internal auditory meatus. B. The foramen oval. C. The foramen rotundum. D. The external auditory meatus. The answer is D. The external auditory meatus. The foramen that forms the ear canal is called the external auditory meatus. This travels through the temporal bone and joins the inner ear to the outer ear. The internal auditory meatus passes through the temporal bone between the posterior cranial fossa and the inner ear, and is the track through which the vestibulocochlear nerve, the facial nerve, and the labyrinthine artery travel from the inner ear toward the CNS. The foramen oval and foramen rotundum are both openings in the sphenoid bones and have to connection to the ear. What is the name of the large opening through which the spinal cord exits the skull? A. The jugular foramen. B. The foramen cecum. C. The foramen magnum. D. The foramen spinosum. The answer is C. The foramen magnum. The large opening in the occipital bone at the base of the skull through which the spinal cord exits the skull is called the foramen magnum, or large hole. It is by far the largest foramen of the skull, and generally measures 1.5 to 3.5 centimeters in the normal adult. The foramen spinosum, foramen cecum, and jugular foramen are all smaller foramen of the skull that transmit various blood vessels and cranial nerves. Which of the following bony landmarks of the skull is an attachment point for the splenius capitis, the longissimus capitis, and the posterior belly of the digastric muscle? A. The mandibular condyle. B. The mastoid process. C. The coronoid process. D. The styloid process. The answer is B. The mastoid process. The splenius capitis, the longissimus capitis, and the posterior belly of the digastric muscle all attach to the mastoid process, a bony protuberance on the inferior border of the temporal bone. This landmark is also an attachment point for the sternocleidomastoid muscle. The styloid process of the temporal bone is directly anterior to the mastoid process, and is an attachment point for multiple ligaments and the styloglossus muscle, the stylohyoid muscle, and the stylopharyngeus muscle. The mandibular condyle and coronoid process are both part of the mandible and do not form any attachments to the muscles of the neck. The inferior alveolar nerve exits through what opening in the skull? A. The foramen rotundum. B. The greater palatine foramen. C. The mental foramen. D. The supraorbital foramen. The answer is C. The mental foramen. The inferior alveolar nerve exits through the mental foramina of the chin. This nerve is a branch of the mandibular nerve and supplies sensory innervation to the lower teeth. The foramen rotundum transmits the maxillary nerve. The supraorbital foramina transmit the supraorbital artery, vein, and nerve. The greater palatine foramen is located in the palatine bone and transmits the greater palatine nerve, artery, and vein. The falx cerebri attaches anteriorly to the skull at what landmark? A. The orbital plate. B. The cribriform plate. C. The ethmoidal labyrinth. D. The cristagalli. The answer is D. The cristagalli. The falx cerebri, the dura that separates the two hemispheres of the brain, attaches to a bony projection of the ethmoid bone called the cristagalli, or crest of the rooster. This projection is a distinct landmark that arises from the cribriform plate. The ethmoidal labyrinth and orbital plate do not form many attachments to the dura of the brain. The supraspinatus tendon passes under what bony projection of the scapula? A. The acromion. B. The superior angle of the scapula. C. The coracoid process. D. The spine of the scapula. The answer is A. The acromion. The supraspinatus tendon passes under the acromion, a bony hook-like process at the end of the scapular spine. Inflammation of the supraspinatus muscle or tendon can quickly lead to entrapment of this muscle under the acromion, causing pain and reduced mobility. The coracoid process, another projection from the anterior scapula, is an attachment point for several muscles and ligaments, including the pectoralis minor and the short head of the biceps brachii. What is the large, fan-like ridge of bone that can be palpated just below the waist? A. The anterior inferior iliac spine. B. The iliac crest. C. The greater sciatic notch. D. The anterior superior iliac spine. The answer is B. The iliac crest. The large, fan-like ridge of bone that can be felt just under the waist is the iliac crest. The anterior superior iliac spine and the anterior inferior iliac spine are smaller protuberances on the ilium that are important landmarks for assessing malpositions of the bones of the sacroiliac joint. The greater sciatic notch is in the posterior ilium and serves as a passage for several muscles and nerves of the pelvic girdle. The head of the femur rests in what bony feature of the pelvis? A. The pubic tubercle. B. The acetabulum. C. The pubic symphysis. D. The obturator foramen. The answer is B. The acetabulum. The head of the femur rests in the acetabulum, a bony socket on the lateral pelvis that is formed by all three bones of the innominate, the ischium, ilium, and the pubis. The pubic symphysis is a midline cartilaginous joint between the pubic bones. The obturator foramen is an opening in the innominate through which multiple nerves and vessels pass. The pubic tubercle is a bony projection on the pubis that serves as an attachment point for inguinal ligament. What bone of the foot forms the heel? A. The calcaneus. B. The cuboid. C. The navicular. D. The talus. The answer is A. The calcaneus. All of the bones listed form the posterior portion of the foot. The largest bone in the foot is the calcaneus. It forms the heel and articulates with the bones of the ankle. What is the name for the bones that form the anterior portion of the foot, but not the toes? A. The metacarpals. B. The phalanges. C. The metatarsals. D. The curbals. The answer is C. The metatarsals. The bones that form the anterior half of the foot, but not the toes, are the metatarsals. These are mirrored in the metacarpal bones of the hand. The carpal bones form the wrist, and the phalanges form the toes and the fingers. Which of the following bones does not form part of the pelvis? A. The ischium. B. The ilium. C. The sacrum. D. The ilium. E. The pubis. The answer is B. The ilium. The pelvis is formed by the sacrum and coccyx and the three bones that come together to form the innominate, the ilium, ischium, and the pubis. The ilium is a part of the small intestine. Which of the following structures passes through the superior orbital fissure? A. The ophthalmic nerve, cranial nerve 5, branch V1. B. The abducens nerve, cranial nerve 6. C. The trochlear nerve, cranial nerve 4. D. The superior and inferior divisions of oculomotor nerve, cranial nerve 3. E. All of these. The answer is E. All of these. The superior orbital fissure, an opening in the back of the orbit formed by the lesser and greater wings of the sphenoid bone, has several important structures passing through it. These include the ophthalmic nerve, CN2, the abducens nerve, CN6, the trochlear nerve, CN4, and the superior and inferior divisions of oculomotor nerve, CN3. It also transmits various blood vessels and the sympathetic fibers from the cavernous plexus. Injury to this area can cause a wide range of ocular pathologies including pain, diplopia, ptosis, exophthalmos, and vision impairment or vision loss. Which of the following is not a fossa of the scapula? A. The subscapular fossa. B. The supraspinous fossa. C. The infraspinatus fossa. D. The suprascapular fossa. The answer is A. The suprascapular fossa. The scapula has multiple fossa that serve as attachment points of various bones and muscles of the shoulder. Among these are the glenoid fossa, where the head of the humerus articulates with the scapula, the subscapular fossa, which is an attachment for the subscapularis muscle, the infraspinous fossa, to which the infraspinatus attaches, and the supraspinous fossa, to which the supraspinatus muscle attaches. There is no suprascapular fossa on the scapula. What is the name of the bone that forms the lower part of the jaw? A. The frontal bone. B. The mandible. C. The zygomatic bone. D. The maxilla. The answer is B. The mandible. The bone that forms the lower part of the jaw is the mandible. It is the largest and most inferior bone in the face, and articulates with the temporal bones at the temporomandibular joints. The maxilla forms the upper jaw, while the zygomatic bone forms the cheek and part of the orbit. All of the following bones of the skull help form the orbit except dash. A. The maxilla. B. The palatine bone. C. The sphenoid. D. The temporal bone. The answer is D. The temporal bone. The orbit is formed by the following bones: the maxilla, the zygomatic bone, the frontal bone, the lacrimal bone, the ethmoid, the sphenoid, and the palatine bone. The temporal bone meets the zygomatic and sphenoid but does not form part of the orbit. All of the following bones form the nasal cavity except dash. A. The nasal bone. B. The vomer. C. The maxilla. D. The sphenoid. The answer is D. The sphenoid. The nasal cavity is formed by the following bones: the maxilla, the vomer, the nasal bone, the palatine bones, the lacrimal bone, and the ethmoid bone. It is also formed by the nasal conchae and the septal cartilage. The sphenoid forms part of the orbit and multiple sinuses but does not form any part of the nasal cavity directly. You are taking care of a 22-year-old basketball player who fractured his clavicle while playing in a game. Which of the following blood vessels is most likely to be compromised by the fractured bone? A. Facial artery. B. Internal carotid artery. C. Subclavian artery. D. Jugular vein. E. External carotid artery. The answer is C. Subclavian artery. Of the listed vessels, the subclavian artery is located closest to the clavicle, just inferior to the clavicle bone, as the name, subclavian implies. As such, if the clavicle breaks and a sharp fragment is formed, it would be most likely to injure the subclavian artery. The internal and external carotid arteries and jugular vein are located within the neck, but more deep and superior to the clavicle than the subclavian artery. The facial artery is located within the face and as such is located very superiorly to the clavicle bone and is unlikely to be involved by a clavicle fracture. The frontalis muscle does which of the following actions? A. Lowers the eyelids. B. Lifts the eyelids. C. Furrows the brow. D. Raises the eyebrows. The answer is D. Raises the eyebrows. The frontalis muscle lifts the eyebrows and wrinkles the forehead. The brow is furrowed by the corrugator supercilii muscle, and the eyelids are raised by the levator palpebrae superioris and lowered by the orbicularis oculi. The frontalis muscle does which of the following actions? A. Lowers the eyelids. B. Lifts the eyelids. C. Furrows the brow. D. Raises the eyebrows. The answer is A. The coronoid process of the mandible. The masseter is a quadrilateral muscle that originates from the zygomatic arch and maxilla and inserts into the coronoid process of the mandible. Its function is to lift the mandible, closing the jaw. What is the function of the rhizarius? A. Depresses the lower lip. B. Purses the lips. C. Keeps food between the teeth. D. Retracts the angle of the mouth, smiling. The answer is D. Retracts the angle of the mouth, smiling. The rhizarius is a small facial muscle that originates on the parotid fascia and inserts into the modiolus. Its primary action is to retract the corners of the mouth in smiling. The lips are pursed by the orbicularis oris. The mouth is compressed and food is kept between the teeth by the buccinator muscle. The lower lip is depressed by the depressor labii inferioris. What are the origin and insertion of the orbicularis oris? A. The mandibular condyle, the fascia of the masseter. B. The temporomandibular joint, the buccinator. C. The maxilla and mandible, the skin of the lips. D. The zygomatic arch, the modiolus. The answer is C. The maxilla and mandible, the skin of the lips. The orbicularis oris, a circular muscle that compresses the lips, originates on the maxilla and mandible and inserts into the skin of the lips. Which of the following muscles assists in frowning? A. The auricular muscles. B. The depressor anguli oris. C. The depressor supercilii. D. The temporoparietalis muscle. The answer is B. The depressor anguli oris. The depressor anguli oris is a small triangular muscle that originates on the mandible and inserts into the modiolus. Its main action is to lower the corners of the mouth in frowning. The auricular muscles are a part of the inner ear. The temporoparietalis muscle is a thin muscle covering the temporal bone, and the depressor supercilii is a muscle of the eye. Which of the following muscles controls the amplitude of sound waves in the inner ear? A. The stapedius. B. The auriculares. C. The ciliary muscles. D. The lateral rectus. The answer is A. The stapedius. The stapedius, the smallest muscle in the human body, controls the amplitude of sound vibrations pulling on the neck of the stapes. The auriculares move the ears. The ciliary muscle and the lateral rectus are both muscles of the eye. What is the action of the superior oblique muscle of the eye? A. Elevates the eyelid. B. Externally rotates the eye. C. Depresses and internally rotates the eye. D. Elevates the eye. The answer is C. Depresses and internally rotates the eye. The superior oblique originates on the annulus of Zinn and inserts into the outer posterior eye. Its action is to depress and internally rotate the eye.
Which of the following innervates the platysma? A. The motor accessory nerve. B. The facial nerve, CN7. C. The vagus nerve. D. The mylohyoid nerve. The answer is B. The facial nerve, CN7. The platysma, a sheet-like muscle that traverses the neck from the clavicle to the mouth and jaw, is innervated by the cervical branch of the facial nerve, CN7.
Which of the following muscles has its origin on the mastoid process of the temporal bone? A. The semispinous capitis. B. The splenius capitis. C. The rectus capitis posterior major. D. The rectus capitis posterior minor. The answer is B. The splenius capitis. The splenius capitis, one of the main extenders of the neck, has its origin on the mastoid process of the temporal bone. The rectus capitis posterior minor, the rectus capitis posterior major, and the semispinous capitis all originate on the knuckle line of the occipital bone. What are the main muscles responsible for keeping an upright spinal position? A. The levators costarum. B. The rhomboids. C. The erector spinae. D. The latissimus dorsi. The answer is C. The erector spinae. While all of the muscles listed are part of the structure and mobility of the back, the main muscle group responsible for maintaining erect posture in the erector spinae. Which of the following is not a part of the erector spinae muscle group? A. The iliacostalis. B. The longissimus. C. The spineless. D. The trapezius. The answer is D. The trapezius. The main muscle groups that make up the erector spinae are the iliacostalis muscles, the longissimus muscles, and the spineless. The trapezius is not a part of the erector spinae group. Which of the following is a muscle of mastication? A. The temporalis. B. The lateral tragoid. C. The medial tragoid. D. All of these. The answer is D. All of these. Mastication relies on four major muscles: the masseter, the temporalis, the medial tragoid, and the lateral tragoid. Which of the following cranial nerve, CN, innervates the genioglossus? A. CN4, the trochlear nerve. B. CN12, the hypoglossal nerve. C. CN9, the glossopharyngeal nerve. D. CN7, the facial nerve. The answer is B. CN12, the hypoglossal nerve. The genioglossus, the main muscle that protrudes the tongue, is innervated by the hypoglossal nerve, or CN12. What is the origin of the inferior oblique muscle of the eye? A. The sphenoid bone. B. The infraorbital margin. C. The annulus of Sien. D. The maxilla. The answer is D. The maxilla. The inferior oblique muscle of the eye, an extrinsic muscle that externally rotates and abducts the eye, has its origin on the orbital surface of the maxilla. What is the action of the sternocleidomastoid? A. Laterally flex the neck. B. Accessory respiratory muscle. C. Extend the neck. D. All of these are correct. The answer is D. All of these are correct. The sternocleidomastoid, a long muscle that originates on the manubrium and the clavicle and inserts into the mastoid process, has several functions. When functioning unilaterally, it rotates the head, flexes the neck, and laterally flexes the neck. When functioning bilaterally, this muscle also extends the neck and is an accessory respiratory muscle. Calcium is required for all of the following except dash. A. Muscle contraction. B. Nerve conduction. C. blood clotting. D. All of these require calcium. The answer is D. All of these require calcium. Calcium is essential for many processes of the body, including but not limited to nerve conduction, muscle contraction, blood clotting, and bone mineralization. Which of the following lists the zones of mitochondrial ossification in the correct order? A. Resting, proliferation, maturation, calcification, ossification. B. Maturation, proliferation, resting, ossification, calcification. C. Proliferation, calcification, maturation, ossification, resting. D. Proliferation, maturation, resting, calcification, ossification. The answer is A. Resting, proliferation, maturation, calcification, ossification. There are 5 distinct zones in regions of mitochondrial ossification. These are the resting zone, the zone of proliferation, the zone of maturation, the zone of calcification, and the zone of ossification. In what zone of mitochondrial ossification do the chondrocytes typically die off, leaving cavities for colonization by osteoprogenitor cells? A. The zone of proliferation. B. The zone of ossification. C. The zone of maturation. D. The resting zone. E. The zone of calcification. The answer is E. The zone of calcification. The behavior of cells in the zones of mitochondrial ossification is as follows: the resting zone, normal resting chondrocytes within hyaline cartilage. The zone of proliferation, rapid mitosis of chondrocytes. The zone of maturation, hypertrophy of chondrocytes. The zone of calcification, the death of chondrocytes due to lack of nutrients and inability to eliminate cellular wastes. The zone of ossification, migration of osteoprogenitor cells into the cavities left behind by dead chondrocytes and mineralization of newly formed bone. Which of the following mineral gives bone its rigid structure? A. Phosphate. B. Calcium. C. Collagen. D. Hydroxyapatite. The answer is D. Hydroxyapatite. The rigid structure of bone is created by hydroxyapatite, a calcium apatite that contains both calcium and phosphate in the formula, CA5PO4, 3OH. Both calcium and phosphate are necessary to create bone structure. A deficiency of either will degrade the structural integrity of the bone matrix. Last, collagen is a protein rather than a mineral, and primarily functions to add flexibility to bone in order to prevent fracture. Bones are made up of which of the following three tissue types? A. Compact bone, white marrow, and red marrow. B. Cancellous bone, spongy bone, and trabecular bone. C. Cancellous bone, fat, and bone marrow. D. Cortical bone, cancellous bone, and bone marrow. The answer is D. Cortical bone, cancellous bone, and bone marrow. Bones are made up of the following three primary tissue types. 1. Cortical bone, which is the hard exterior layer, also referred to as compact bone. 2. Cancellous bone, which is the porous bone tissue that fills the center of bones, also referred to as spongy bone or trabecular bone tissue, and 3. Bone marrow, a hematopoietic tissue that fills spaces in trabecular bone. Which of the following is the term for the functional unit of compact bone? A. Lamella. B. Haversian canal. C. Osteon. D. Trabeculae. The answer is C. Osteon. The functional unit of compact bone is the osteon. The osteon is formed by concentric layers of compact bone called lamellae. These surround a central canal called the Haversian canal. Trabeculae are the functional units of cancellous, spongy, bone. Which of the following cells is responsible for depositing hydroxyapatite into bone matrix? A. Osteoclasts. B. Osteoblasts. C. Osteocytes. D. Myelocytes. The answer is B. Osteoblasts. Osteoblasts are the cells responsible for the deposition of hydroxyapatite into bone matrix. In addition to hydroxyapatite, they synthesize collagen, osteocalcin, and osteopontin. Osteocytes are undifferentiated osteoblasts, while osteoclast cells function in opposition to osteoblasts by removal of mineralization from the bony matrix. Myelocytes and normoblasts are both hematopoietic cells of the bone marrow and do not take part in bone mineralization. Which of the following is in the Haversian canal? A. Red bone marrow. B. Periostom. C. White bone marrow. D. Capillaries and nerves. The answer is D. Capillaries and nerves. The Haversian canal allows capillaries and nerves to pass through the cortical bone to nourish osteocytes, osteoclasts, and osteoblasts. Both the white and the red bone marrow are contained within trabecular bone, while the periostom is a thin, highly innervated membrane on the outside of bone. In regards to bone marrow, red marrow is primarily made up of underscore cells, while yellow marrow is primarily made up of underscore cells. A. Hematopoietic. Fat. B. Proliferating. Calcified. C. Active. Dormant. D. Erythrocytic. Leukocytic. The answer is A. Hematopoietic. Fat. Variation in color of bone marrow cells is not related to their level of activity, calcification, or the types of blood cells they produce. Rather, red marrow is primarily hematopoietic cells, both red and white progenitor cells, while yellow marrow is primarily composed of fat cells. Growth in long bones must occur at the dash. A. Epiphyseal plate. B. Diaphysis. C. Suture. D. Epiphysis. The answer is A. Epiphyseal plate. Growth in long bones occurs at the epiphyseal plate, a region of hyaline cartilage at the metaphysis of the bone. In adolescents and children, cartilage cells are ossified by osteoblasts to increase bone length. Once adulthood is reached, the epiphyseal plate becomes the epiphyseal line at the junction of the epiphysis and the diaphysis, the center of the bone. The diaphysis and epiphysis themselves are composed of mature ossified bone and do not proliferate. They are simply added to by transformation of cells in the epiphyseal plate. A suture is a fibrous joint of the cranium and does not contribute to the development of long bones. The length of long bones is increased via the hypertrophy and eventual apoptosis of chondrocytes, which leave cavities that are then colonized by osteoprogenitor cells. This process is referred to as dash. A. Osteoblast mineralization. B. Apoptotic ossification. C. Endochondral ossification. D. Endochondral mineralization. The answer is C. Endochondral ossification. Long bones are lengthened during childhood and adolescence via a process referred to as endochondral ossification. In this process, chondrocytes of the growth plate hypertrophy and eventual die, leaving cavities that are then colonized by osteoprogenitor cells. These osteoprogenitor cells then differentiate into osteoblasts, which mineralize the newly forming bone. None of the other answers are actual processes in bone formation or physiology. Which of the following is not a common site of hematopoietic bone marrow in an adult? A. Pelvis. B. Sternum. C. Skull. D. Tibia and fibula. The answer is D. Tibia and fibula. In adults, hematopoietic bone marrow is generally confined to the flat bones, including the sternum, the skull, the ribs, and the pelvis. Hematopoietic bone marrow also exists in the proximal end of the femur in most adults, but is not generally found in the tibia or fibula. Muscle is attached to the periostem of bone via which of the following? A. Articular cartilage. B. Sutures. C. Ligaments. D. Tendons. The answer is D. Tendons. Muscle attaches to bone via tendons, fibrous extensions of the sheath of the muscle body that are primarily composed of tightly packed collagen fibers. In comparison, ligaments attach bones to other bones without involvement with a muscle, such as the ligaments between the metacarpals of the wrist. Sutures are fibrous joints of the cranium, and hyaline cartilage is at the point of articulation of many bones, but it is neither incorporated into muscle structure, nor does it attach to the bone with which it articulates. Rather, articular cartilage primarily serves to allow bones to glide more easily over each other during movement.
The individual unit of muscle contraction in a muscle fibril is referred to as the dash. A. Sarcoplasmic reticulum. B. Sarcolemma. C. Sliding filament. D. Sarcomere. The answer is D. Sarcomere. The individual contractile unit of a muscle fibril is referred to as the sarcomere. These units are made of actin and myosin filaments and joined by Z-lines. The sliding filament theory refers to the idea that muscle contraction is the result of myosin strands within the fibril pulling themselves along actin strands similar to pulling on a rope, which shortens the whole sarcomere. The sarcolemma is the specialized cell membrane around the muscle fibril, and the sarcoplasmic reticulum is the smooth endoplasmic reticulum found within the muscle cell.
Which of the following is the correct order of structures in a skeletal muscle, from largest to smallest? A. Fiber, fascicle, fibril. B. Fiber, fibril, fascicle. C. Fibril, fascicle, fiber. D. Fascicle, fiber, fibril. E. Fascicle, fibril, fiber. The answer is D. Fascicle, fiber, fibril. The largest unit of muscle tissue is the fascicle. Each fascicle is made up of a bundle of muscle fibers, and every muscle fiber is made up of many fibrils, called myofibrils.